information from the Office of Information Technology, and we'll have Heather Roth, Immunization Branch Chief from the Division of Disease Control and Public Health Response at CDPHE. A couple of reminders here. We do have a couple of interpretation channels. We have an ASL interpretation channel for American Sign Language, and we have a Spanish language interpretation channel. And if you're looking to record some screen grabs here, feel free to use that gray slider bar in the middle of your screen to customize your view between the slides and the presenters. So without further ado, we will go ahead and hand it over to Scott Bookman.
Thank you, Brian, and thank you to everybody for joining today. Normally we're joined by Dr. Herlihy for the epidemiology update. She's off today, and so I'm going to present some information here on where we stand today. And what you see is our continued upward trend that really began in August. And 10 of the last 14 days have had an upward trend in our 7-day moving average of newly reported cases. And we are still incredibly concerned about the trajectory that Colorado is on as of today. And this trajectory does continue to go up. On the next slide, we will show you that our trajectory of hospitalizations also continues to rise in this current wave. And as of yesterday, we were at 1,267 people hospitalized in Colorado with COVID-19. Still below that peak of 1,847, but our trajectory does continue to go up. And it is growing rapidly. And you'll see on our next slide our comparison of COVID cases and hospitalizations to the availability of hospital beds. And so on this slide, on this graph, what you'll see is the very familiar pattern here of the waves that we have seen of COVID since March of 2020. And you can see that in December 1st, actually, of 2020, we hit that peak of 1,847 people hospitalized with COVID. At the time, we had an additional 1,800 beds available. Today, we are at about 1,296 people hospitalized with COVID on this graph. And what you can see is that over the last 7 days, our moving average of hospital beds is down to 815. And so obviously these are incredibly concerning numbers. And we're working with our hospitals, working with the Combined Hospital Transfer Center to ensure that we are using every bed available. And on the next slide, we will talk about what we talk about on a frequent basis, is that we continue to see the impact of the unvaccinated on our hospitals. And 80% of those who are currently hospitalized in Colorado are unvaccinated. And as we look into the coming weeks and the coming months as cases are going up today, I cannot stress enough how critically important it is for those who are unvaccinated to move towards the decision to get vaccinated. For all of those who are eligible to get the booster shot, we really do encourage people to actively move towards getting that booster as soon as they can to ensure that they have the highest level of protections possible. And with the amount of COVID in our community and in our state at this point, really do want to make sure that people are being careful. Wear a mask when you are indoors. If you are sick, stay home, get tested. The best thing you can do is to know whether you have COVID or not. If you are positive and you qualify, let's get you monoclonal antibodies. These are treatments that are incredibly effective in keeping people out of the hospitals, having a less severe course of disease. And of course, we're excited that this weekend we're really starting our campaign for vaccinating 5 to 11-year-olds in earnest. And with that, I'll take the opportunity to pass it to Heather Roth to give an update on that.
Thank you, Scott. I share in the excitement and the energy that has come with the authorization of the Pfizer vaccine for kids between the ages of 5 to 11. ACIP met earlier this week and unanimously recommended that vaccine for 5 to 11-year-olds, and the CDC director signed off on it the same day. We've been planning for this younger age group for months. And so I just wanted to highlight some of the partnerships that are in place really statewide. This isn't just a metro effort. This is reaching out to all four corners of our state. Next slide. This weekend really does kind of mark the launch of our vaccination efforts for 5 to 11-year-olds. So you can see that we've got 4 separate locations of recurring clinics with Children's Hospital Colorado. The Anschutz and the Colorado Springs locations will start this afternoon with Friday evening clinics, and then Saturday, Sunday, all-day clinics. We've got one of our mobile buses out at the Highlands Ranch location. Lots of positive energy, lots of happy kids being vaccinated there today. 2-day clinics at the Pueblo Zoo. Tomorrow, Denver Zoo will also be holding a clinic. Boulder Community Health, you can see they're set up for some clinics in November, as well as the Rocky Mountain Hospital for Children. Community Hospital out in Grand Junction. And then our third zoo, Cheyenne Mountain Zoo, set up for November 13th with El Paso County Public Health down in Colorado Springs. WOW Children's Hospital in Lafayette, and then Girls on the Run, Rockies 5K at Denver City Park. Our Children's Museum here in Denver, as well as the Colorado Rockies at Coors Field in mid-November. And then Eureka McConnell Science Museum, again, back out in the Western Slope in Grand Junction. Dinosaur Ridge at Morrison, and Lafayette Public Libraries. These are all confirmed clinic dates that are supported by the state. And again, Reach Out and Read has been a great partner in giving out books at some of these clinics to kids. Next slide. And we've got a lot of more scheduling in process. We want to make this opportunity and this vaccination experience for kids a positive experience. They are going to have to come back 21 days later for a second dose. And so doing everything that we can to partner with youth-focused organizations and kind of fun activities in local communities, again, to make this a positive experience for Colorado's children. Next slide. I also just wanted to highlight this map because I really think it speaks to not only state planning efforts, but local planning efforts and school district planning efforts. So I'm going to start with the black stars that you see kind of scattered throughout the map. These are those confirmed large community vaccination events across the state. Then when you see kind of the purple school building, those are school district located COVID vaccine clinics. Again, all over the state. The red pins are local public health agency clinics. And then the green pins that you see are where the state is supporting local public health clinics, either through a vaccine support team or one of our mobile buses. The kind of gold circles that you see in many counties, not all, but many, are orders that have been placed by our retail pharmacy chains across the state. The bigger that circle, the more doses that have been ordered for that particular county. And then the gradient shading that you see just kind of highlights the number of doses that have been ordered within a county as well. So the darker the shade, the more doses that have been ordered at certain provider locations across the state. So a lot happening, a lot of opportunities for vaccination for 5 to 11-year-olds. And we're just thrilled with the launch of this program this weekend. Next slide. So as more providers receive vaccine, they're opening vaccine scheduling appointment opportunities for parents. This website is where we'd love to direct parents to visit. It's constantly being updated with new information, new scheduling links. So we encourage providers, parents to find providers near them. And with that, I think I'm going to pass it to Russell.
Thank you very much. So I am really excited to announce the new version of the My Colorado app. Many of our users had trouble in low and no internet connectivity areas when they were going to concerts and games. So we heard you. And so if you install the newest version of the app on Android, it's 5.0, on iOS, it's 5.1. Make sure you refresh your vehicle registrations, insurance cards, fishing licenses, and of course, your vaccination card. And that'll make them available wherever you are, regardless of connectivity. We also made the app work a lot faster overall. What's really cool is when you refresh your vaccine card, you will see our newest feature that I'm the most excited about. And what you see in the picture here is our Smart Health Card, also known as the vaccine QR code. And smart health cards, they Inside that QR code, they have the same information as your regular CDC vaccination card with a tad more detail on the immunizations themselves. So the nice thing about them is it makes it nearly impossible to fake vaccination information because they're encrypted and signed by the state or by the issuer. Visually, you can see that it shows if somebody's partially vaccinated, completely vaccinated, or I don't know why anyone would show you a card that says they're not vaccinated, but it would do that too. Best of all, this might be your key to international travel or even domestic travel, as the Smart Health Card standard is accepted widely across the United States and internationally. Now, like the existing CDC vaccination card, the information comes from Public Health and Environment's Colorado Immunization Database, or also known as SIS. And what's even better is that if you've got the newest version of iOS that's 15.1 or better, you can download into your Apple Health Wallet automatically. There's information on it at the FAQ on mycolorado.gov website. Of course, the use of MyColorado is free. It's secure. No one's required to access their vaccine information through MyColorado. It's just a service that you can use voluntarily. Access is protected by your login credentials, as well as your face or touch ID, and world-class multi-factor authentication. Another nice feature of this is that business owners can get really excited about this because anyone can download the Smart Health Card Verifier app from the App Store or the Play Store. And this lets any individual or all the people that work for these businesses to access the information on the QR code, right? So they can visually check it, but it's a lot faster to scan a barcode that reads in about a second than sort of try and figure out what's written in chicken scratch on a very old immunization card that was done maybe 6 months or 9 months ago. So this should help them get you into all those venues much more quickly and really eliminate a lot of the doubt around them. And of course, after you show them your Smart Health Card or vaccination card, you can swipe over and show them your Colorado Digital ID to prove you are who you say you are. Another thing I wanted to mention is that the popularity of MyColorado is pretty insane. We've got over 405,000 Colorado residents using it in conjunction with their state ID or driver's license. Over 200,000 people have downloaded a vaccination card. So make sure you're using the most updated version from the app or Play Store. And when you log in, it may take a minute or two the first time after you've reloaded it, because we do have so many people logging in. So please be patient. Know we're working overtime to improve the performance every single week. Also, I'll mention that a few users, a small fraction, have experienced some quirks in the updating of their app. The easy solution is to delete the app and reinstall it. Your information should come right on through. And that is all I've got. So thank you very much.
All right, thank you to all of our presenters, Director Bookman, Russell Castanero, and Heather Roth. We're going to go ahead and open it up to the media Q&A portion of this afternoon's press conference. We'll use the raise hand function and we'll go through one at a time. Let's stick with first questions first. If we have time for second questions or follow-ups, we'll certainly be happy to roll back around. Please state your name and the outlet that you're from before asking your question. And if there are any topics that were not covered today or anything that you need additional information on, please email us at media_info@state.co.us. Let's go ahead and start with Chris Vanderveen.
Chris Vanderveen with 9 News. Scott, I want to ask you a capacity question. One, can you confirm that we have now less than 100 available ICU beds in the state of Colorado? And two, it does appear as if we certainly have had times in the past where we had more available acute care beds and ICU beds available than we have now. And particularly when it comes to acute care beds, there's a pretty steep drop off at the beginning of October. Can you explain why we have fewer beds now in terms of acute care beds and ICU beds than we had maybe a few months ago?
Thanks, Chris. So, yeah, I mean, as of today, looking at the data that is reported by the hospitals, we are at the lowest number of beds we've had available. And we do have less than 100 ICU beds open at this moment. Now that number fluctuates. We know that people move in and out of beds, but the downward trend does continue. As to why we saw this steep drop-off begin occurring, I think it's a combination of many different factors. And what we've really heard from our hospitals, our healthcare systems, is that the impact of delayed care over the course of this pandemic has been significant. As you know, procedures were canceled early on in the pandemic to protect PPE. People delayed their care. People have been fearful of going to their doctor or going to the hospital for fear of getting COVID. And so, the impact of that delayed care combined with the general return of normalcy to most people's lives has increased the amount of trauma cases that we see out there. We do know that there have been behavioral health impacts on many people of this pandemic, and then add in the increasing number of COVID hospitalizations that we're seeing. That increases the volume, the demand on our hospitals, and additionally, our healthcare workforce is tired. Our healthcare workforce is burned out. And when we talk about beds, those are beds that are staffed. It's not just an empty bed. It comes with a nurse and a doctor and a respiratory therapist and all of the support services that ensure that care can be delivered. And so that is really all coming together right now to create this challenge.
All right, Marshall.
This kind of tags on to Chris's question, but Scott, looking at where there are fewer ICU beds, are you seeing a correlation to the staffing issue that you just addressed? Are you seeing fewer ICU beds available because of fewer staff in highly unvaccinated parts of the state?
I don't see any direct correlation there, Marshall. What we see is that the vast majority of our ICU beds are along the I-25 corridor. What you see in healthcare is that really the highest acuity beds are in the areas where there are the most people. And so, well before COVID, people who needed a higher level of care, who lived in more rural areas, would very often be moved into Denver metro area or northern Colorado or even to Grand Junction to receive their care. And so, we continue to see that pattern today, that those movements into the more urban areas to receive that higher level of care.
Let's go to Meg Wingerter.
I have a question about the special clinics at libraries and zoos and whatnot. So is the idea that you're going to have those, have subsequent clinics there that everybody who gets their first shot there will come back 3 weeks later, try to refer people to other options for that?
I think it kind of varies by the event. Many of them, including several that were on the slide today, do have a second clinic already scheduled for 21 days later, and they would be, intended to be second dose clinics. The other thing is that we're in a much different place now than we were in the original rollout of COVID vaccine response. We have more than 450 providers across the state that are actually carrying the Pfizer vaccine for 5 to 11-year-olds. And so there, I think, is ample opportunity in local communities for that second dose commitment.
Seth Klayman.
Hi, Seth from the Gazette. Scott, this is probably a question for you. Can you speak to the release of the CMS regulations about their healthcare vax mandate, which seems to align pretty closely with Colorado's? Thanks.
Yeah, Seth, I don't think there's really all that much to say on that one. Colorado led in this area with our vaccine mandate. We knew that the Fed mandate was coming. We need to dig a little bit deeper into it and understand exactly who may be covered additionally that wasn't covered by the state mandate. But at this point, the more people that are vaccinated, the better. This is our ticket out of this pandemic, and any tools that help increase vaccination rates are just taking us one step closer.
Let's go to Darius Johnson.
Hey, Darius Johnson from 9 News. We have been hearing from a couple of viewers that they have made appointments for their kids ages 5 to 11 to get their first dose of the Pfizer vaccine. Some of them have appointments and they are showing up and learning that they don't have enough supply or they don't have any shots available. What does supply look like right now for the state to be able to vaccinate a lot of these Coloradans within that age group?
Thanks for that question. So we have actually not heard around any sort of issues around vaccine supply. So we, across the state, both through our state distribution channel and the federal pharmacy distribution channel, we've ordered over 243,000 doses for the program launch. We've received here in the state already 128,300 doses. It's enough to cover about 25% of Colorado's children between the ages of 5 to 11 pretty immediately. So I don't think vaccine supply is an issue. I think it's kind of the I wouldn't call it a trickle, but it's the vaccines coming not all in one day, right? It's kind of a phased delivery approach. And we've got about 52% of the vaccine that we've ordered already in the state ready to go for this weekend.
Let's go to John Daly.
Hi, John Daly, Colorado Public Radio. I think this is for you, Scott. What do you think is driving this wave of cases, transmission, et cetera, this fall? And are you surprised by it, by either that it hit or that it hit as in the magnitude that it's hitting now?
Yeah, obviously, I think we're all disappointed that we're here today. When the first vaccines arrived in the state in the middle of December last year, I really did think that we're moving beyond this part of the pandemic. And unfortunately, this is where we find ourselves today. Nationally, you are starting to see the reverse of the downward trend. And there is the beginning of a flattening across the country and new cases being reported. And so, I think we still have a lot to learn about COVID and how it moves through communities and moves through states. There are waves of this, and there are probably seasonal factors. And what we do know for sure is that the Delta variant is very efficient at finding those who are unvaccinated and making them sick. And so, again, the more people who get vaccinated, the quicker we have an opportunity to move past this phase in the pandemic. For those who are eligible for those boosters, it really does increase your protection against where we are today. And so, wear a mask, stay home if you're sick, and get those shots.
Let's go to KDVR Digital.
Hey guys, it's Alex Rose with Fox 31. Scott, this one's for you. You mentioned, delayed care as a reason that we're seeing a lot of Coloradans in the hospital. With COVID not being a factor, what do you see as is the greatest factor that's driving folks to the hospital outside of COVID? Thank you.
Alex, I don't think I can give you one single thing that's doing it. I think that our hospitals, frankly, are still trying to understand exactly what it is that is driving this. But we do know that, a delayed colonoscopy can mean finding a cancer later. We do know that, not going to see your doctor may result in you not getting that EKG. That could be an indicator of heart problems. And so, again, I do want to stress to the public that, our hospitals are safe. Our doctors' offices are safe places. And it is really important to make sure that you go get your preventative care, your specialty care to keep yourself as healthy as possible.
All right, do we have any other first questions in the room? All right, let's go back to Meg Wingerter.
Hello, from the Denver Post again. So we're less than 3 weeks out from Thanksgiving. You mentioned, general precautions people should be taking to avoid getting sick right now. Is there anything people should be doing or keeping in mind when they're trying to decide, do plane to go and see grandma or what have you?
This is Scott. I'll take that one. I mean, obviously, vaccination, right? Get your booster. If you haven't been vaccinated yet, get your first dose. And, we've provided information previously on, what that timeline looks like, but we really would encourage vaccination. And then, outside of that, obviously smaller gatherings are safer than larger gatherings. Knowing the vaccination status of those that you're gathering with is also important to assess your risk and wear a mask. And if you can have your activities outdoors or in a well ventilated room, that is safer. People can gather, but we need to do it safely at this time of increased virus in the state.
Let's go to Michael Booth.
Thank you, Michael Booth with the Colorado Sun. Have you or has Dr. Hurley recommended to Governor Polis that he reinstate a statewide mask order?
At this point in the pandemic, even though we're seeing increasing cases across all of, across the state, there are differing rates of disease in different communities, in different counties. And we have really been working with our local public health partners, our local elected officials to ensure that they have the information that they need to make the right decisions for their individual communities.
All right, and let's go back to Alex Rose.
Last time I asked this question, Scott, you and Dr. Hurley, he indicated, and this is about natural immunity, that it's really tough to track and quantify because it requires somebody getting 2 tests to prove that they have tested positive for the virus twice. I'm just curious, has the state gotten any closer to being able to measure, or quantify how robust natural immunity is from the virus after you've gotten it?
We haven't, and that's an issue across the country and frankly across the world, where there's still efforts ongoing to understand the level of natural immunity that people get when infected. I think with the asymptomatic spread of this illness, the lack of early testing that was available across the country, we know less than we want to. But what we do know is the vaccine is safe and effective. And what we know is the vaccine gives you immunity. And that is really, again, our ticket out of this.
And we can also follow up with you to send you some information on that from the CDC that we have. So we're happy to share that with you afterwards. All right, so thank you everybody for joining us this afternoon. If there's any questions we weren't able to get to or any topics that were not covered, please email the media team at media_info@state.co.us, and we hope you have a good weekend.